Now to Uganda, where the country is battling a surge in foodborne illnesses, pushing food safety to the top of the country's public health agenda. Health officials say the cost is staggering, with an estimated $15 billion spent every year treating cases linked to contaminated food. The UN's Food and Agriculture Organization and the World Health Organization say that everyone handling food for sale needs proper training in hygiene and safe preparing. Now, as part of finding solutions, the WHO will run a pilot study in Uganda examining food safety and hygiene standards among street vendors. The research carried out with the FAO is expected to guide new rules and tougher enforcement. Kabanda David, the Executive Director of the Center for Food and Adequate Living Rights, joins us to unpack this situation. David, thank you so much for joining us. I would like to start by asking, what are the major factors contributing to the foodborne illnesses that the country has to invest so much in every year?
The major factors are about regulation. We do not have very good regulation. We have pet foods that are not regulated. We have food growing that is not regulated. And also very negligent, but also many people are ignorant. Because now when you look at the food systems angle, many people grow food using chemicals, and when the food gets stored, they add more chemicals. When the food comes to the market, there are too many, value chains that are not regulated, and they end up causing, contamination. And in storage, you find that many people, store the food in environments that are not good, and then this causes contamination like aflatoxin. And now, beyond that, when it comes to cooking of the food, they use unregulated oils. They add other substances like transformer oil. So all that compound to a very unhealthy food, access in many parts of Uganda.
So let's talk about the food safety regulations and enforcement mechanisms in Uganda. How does this address the issues that we're talking about? I mean, there are lots of issues outlined, and we have a body that is meant to enforce some mechanisms, like the name implies. How does that solve the problem?
We have a challenge. Not many leaders, particularly at local government level, have picked out this particular problem. So you have Ministry of Health, which is not doing its work because it starts with them, but also local governments who are supposed to regulate markets, who are supposed to regulate restaurants, street food. They are only interested in getting money out of the licenses that they give the people to operate, but they do not go ahead to issue certificates of public health concern. So that's where the problem is, and they do not put in their budget money to go ahead and make sure that they implement. Because we have a Public Health Act which talks about food, but that is not implemented yet.
So before we let you go, can you identify any successful strategies or interventions that have effectively reduced foodborne illnesses in Uganda or in similar contexts?
One, I think we need to go back to the drawing board. WHO, FAO have developed some guidelines which we must follow. One, in surveillance and monitoring the entire food, value chain. But number two, in between, we need to have a lot of awareness. We need to teach people's mindset towards food, because many people think or do not think at all that food can cause death, food can cause disease. And number three, we need to invest in enforcement. We need to invest in legal departments, having also lawyers to come on board, because many of these people do not think that they should be accountable, and making sure that when we discuss food, whether at local government level or national level, we embrace a food system angle, a food system approach, and then look at the different value chains, because although pathogens in the food that is sold in ordinary markets is a problem, but we also have millers and other food marketeers or food industry that are also using, illegal chemicals, that are using banned chemicals, that are using high salt, sugar, and fat. And we also ask the Ministry of Health to quickly pass the nutrient profiling model, because it will be one of those tools that Uganda needs to make sure that the health diets are available to everyone.
All right, Executive Director for the Center for Food and Adequate Living Rights, Kabanda David, thank you so much for joining us.